Hi, my name is Mary Calhoun Brown. I'm an award-winning author of There Are No Words. It's a book with an autistic protagonist. And today I'm video blogging to answer some questions that I've had from parents and educators about Asperger syndrome and autism. Before I start, I just want to say this is my book. It's available everywhere, but you can also get it on my website, www.marycalhounbrown.com. Okay, so now we'll get started with the question. The question for today is from a teacher, and she says, I'm working on an IEP for a preschooler who, when he gets upset or frustrated, he hits, kicks, scratches, bangs his head, etc. Her question is, should she work the IEP goal to say child will learn different strategies for self-calming during times of frustration, or the child will use appropriate strategies for controlling his body when anxious, angry, or frustrated? First of all, I just want to say thank you to the educator who sent me this question, and if anyone else has any similar questions, you're welcome to use the contact tab at my website, www.marycalhounbrown.com, to ask questions, and I'll try to answer them in a timely manner. So the teacher asked, what do I think, and what would I put for the short-term objective? And here's what I would like to answer to the teacher. I think at first you're going to need to ease him into self-calming activities. One goal for the IEP team would be to find out what is causing the behavior. Children just don't have self-stimming or self-stimulating behaviors for no reason. It has to meet some kind of a need for them. He's trying to tell you something with his stimming. He's either overstimulated in some way, and when you can determine what the cause of his outburst or what the function of that outburst is, only then can you expect a change in his behavior. And this little boy is probably incapable of calming himself until the people around him can fix the environment. If you choose to make his IEP goal that he needs to find self-calming strategies, I'm just worried he won't be able to meet that goal. First, look at his environment. Do you have fluorescent lights? If you do, stop using them. Get some lamps or some alternative lighting. Is he sitting in the middle of the classroom? If so, move him next to a wall or at the front of the room where he's bordered on at least two sides by predictable things, a wall, a chalkboard, or you. The unpredictable movement and noise coming from the other children might be bothering him. So sit in your classroom when no one's around and listen and experience what your senses tell you. If there's a humming sound or a clanking coming from the furnace, he may not be able to distinguish between the sounds that surround him and your voice. There may be smells coming from the cafeteria. The lighting may be off. There could be any number of things. Often when children are overstimulated, they'll focus on just one thing. It's usually something visual, and they will literally be unable to hear you when you're talking. And as your voice naturally rises for him to hear you, he still doesn't hear you. And finally, when you call his name out harshly because you feel he's ignoring you, which he probably, that would be a normal response, he's shaken from his focus, and he wonders what everybody's yelling about. So, just try to take a look at the environment and see what's causing his stimming and his outbursts, and try to change that. And sometimes it's just a little thing. Sometimes it's a number of things all put together. But I just want to say God bless you for caring about this child, and blow him a kiss from me, and good luck with your IEP meeting. Thank you to those of you who've been tuning in. I'm going to put my low-tech web address up here for you to see. It is www.marycalhounbrown.com. And please check out my book and check out my website. Thanks so much for tuning in, and I'll see you next time.